In this video, we are going to discuss in details about anti-glaucoma drugs. So at first, we will discuss about some anatomy and physiology of eye. The eye cavity is mainly divided into two parts, the anterior cavity and the posterior cavity, and it is divided by this lens. The fluid in the posterior cavity is called vitreous humor and the fluid in the anterior cavity is called aqueous humor. This whole anterior cavity is further divided into anterior chamber and posterior chamber by this iris. And the space between iris is called pupil. This is our cornea and this is our iris. So here an angle is produced. This is called iridocorneal angle. This part of eye is called uvea and the white part here is called sclera. This part here is called ciliary body and this ciliary body has some capillary. This ciliary body filtrates the blood and produces aqueous humor. So the aqueous humor is secreted and comes to the anterior chamber of the eye through this pupil. And it provides nutrition to the avascular cornea. And after it has done its job, it passes through the iridocorneal angle and enters into the canal of Schlemm. This is also called trabecular outflow. So the aqueous humor is secreted from ciliary body and enters into the posterior chamber of eye. Then through pupil it comes to the anterior chamber, provides nutrition to the cornea, and after doing its job it is drained through the trabecular outflow. But it has another emergency drainage channel. If this channel is blocked, it will directly pass through this emergency drainage channel, and as this is situated at the uvea and scleral part of the eye, this is also called uveoscleral outflow and it is known as emergency drainage of aqueous humor. So there always remains a balance between the production and the drainage of the aqueous humor, and a normal pressure is always maintained, that is 15 to 20 millimeter of mercury pressure. If there is excessive secretion or reduced outflow due to some reason, that will result in increase in intraocular pressure, and increase in intraocular pressure more than 20 millimeter mercury pressure will be called as glaucoma. On the basis of whether this iridocorneal angle is open or closed, glaucoma can be divided into open angle glaucoma where this angle is open and closed angle glaucoma where this angle is blocked. In our previous videos, we have said that meiosis helps in glaucoma and mydriasis aggravates the condition of glaucoma. How actually this happens? When there is meiosis, the pupil is constricted. So the iris is elongated. But when there is mydriasis, the pupil will dilate. So what will happen to the iris muscle? This iris will look like that. So we can see that here this opening is blocked by the iris when there is mydriasis. In normal person, this mydriasis does no problem, but in a patient in whom the canal of Schlemm is already narrowed or blocked due to some reason, this is very dangerous condition. So here we can see that meiosis causes elongation of iris muscle and that helps in maintaining patency of trabecular outflow, and when there is mydriasis, that will block the trabecular outflow and deteriorate the condition of glaucoma. So on the basis of whatever we have discussed, what we can do to prevent glaucoma is that we can reduce the secretion of aqueous humor, or we can increase the drainage of aqueous humor through the trabecular outflow or through the uveoscleral outflow, or we can produce meiosis that will help in drainage of aqueous humor. So we have these three options mainly. At first, we will discuss about drugs that will decrease the secretion of aqueous humor. So what we can do, we can constrict this blood vessel, which will result in decreased blood supply and decreased filtration by the ciliary body. So which drug we can use here? We can use alpha agonist. We know that alpha agonist will produce vasoconstriction, or we can use beta blockers. We know that beta stimulation causes vasodilation. So if we block the beta receptor, that will lead vasoconstriction. So both of them will help in reduce the secretion of aqueous humor and can be used in treatment of glaucoma. So the drug in alpha agonist group is difibeprin, eptraclonidine and brimonidine. We can remember the adverse effect of this drug from their name. We can see that eptraclonidine contains LID. So you can remember eptraclonidine causes lead retraction. We can see brimonidine contains BR, that means brain, and here I means inhibition. So brimonidine causes brain inhibition especially in children, which can produce apnea. So brimonidine is contraindicated in children especially less than 2 years old. And the drug difibeprin is a product. When it enters into the circulation, it is converted into epinephrine or adrenaline. And when this adrenaline comes into contact with the air, it will produce adrenochrome, which causes black pigmentation of the conjunctiva. We can use almost every beta blocker topically on eye except the drug that possesses membrane stabilizing activity. We have discussed why we cannot use membrane stabilizing activity property in glaucoma in our previous videos. So the beta blocker we can use in glaucoma is timolol and betaxolol. They have fewer side effects, but you can remember the systemic adverse effect of beta blockers that A, B, C, D. Here A means asthma, B means AV block, C means acute congestive heart failure, and D means diabetes mellitus. The third group of drug is carbonic anhydrase inhibitor, and in aqueous humor, carbonic anhydrase enzyme increase the secretion of aqueous humor. So if we block the carbonic anhydrase enzyme, it will result in decreased secretion of aqueous humor. And the drug in carbonic anhydrase inhibitor group ends with zolamide. And the drug name is acetazolamide, brinzolamide and dorzolamide. And the fourth group of drug we can use to reduce the secretion is osmotic diuretics such as mannitol. These osmotic diuretics will pull the water of the aqueous humor into the blood vessel, and that will help in reduction of intraocular pressure. The second mechanism we can use is increase the outflow of aqueous humor. We have two options here. We previously said that either we can increase the trabecular outflow or either we can increase the emergency canal or uveoscleral outflow. And we also said that if we use the meiotic drug, that will help in increase drainage through the trabecular outflow. So the meiotic drug in this group is pilocarpine and physostigmine, which are anticholinergic drugs. And the adverse effect of these meiotics we can remember from the last two words of meiotics. The C indicates cataract and the S indicates stenosis of nasolacrimal tract. And the second method is increase in uveoscleral outflow. Our uveoscleral drainage system contains prostaglandin receptor, and if we stimulate the prostaglandin receptor there, that will increase the drainage of uveoscleral canal. And the drug in this group is latanoprost and bimaprost. The adverse effect of this drug we can remember from PGF, that is pigmentation of iris, that is also called heterochromia iridis. In our previous slide we have said that the difibeprin also causes pigmentation, but the pigmentation is on the conjunctiva. But here we can see the pigmentation is on iris. So you need to remember that. And here G indicates growth of eyelashes, which is also called hypertrichosis. And the third side effect that is indicated by F is fluid in macula, which is also known as macular edema. So that's all about the anti-glaucoma drug. Thank you for being with me. Please like, comment and subscribe.